I'm Shankar Pasupathy. I'm a general surgeon at Mount Elizabeth Hospital. I specialize in gastrointestinal surgery and also bariatric surgery, which is the medical term for weight loss procedures. Bariatric surgery refers to weight loss surgery. The main aim of this type of surgery is to make the stomach smaller so people can eat smaller meals and feel satisfied with that. It's not really designed to restrict people from eating or to prevent people from eating, as is common misconception among the public. Who can benefit from bariatric surgery will be people who have been struggling with keeping their weight down. They've noticed that over the years, despite their best efforts of trying to control their diet and trying to be active and maintain a lifestyle that's more active and outdoors, they find that the weight is creeping up. So this can be a very powerful tool to help people to keep a check on their weight and also help them to lose weight. Now, not everyone obviously should be considering bariatric surgery because it is, after all, a major step to undergo. But if your weight has crossed to at least 30 or 50 kilos above your ideal weight, and this is not that difficult to achieve because some people will find that as time goes on, they will be gaining about 1 to 2 kilos a year. This will put them at maybe 80 to 100 kilos when they're starting off at, sorry, this is all
No problem.
it's going too far. Yeah, so who can benefit from bariatric surgery? Now, this is a very interesting question because actually weight is a very complex thing. Weight by itself can carry problems related to physical as well as medical, and there's the other aspect which is the psychosocial. Now, what are these physical problems that people face is that they get pain in their joints, the back, the knees, the feet. When they are active, moving around, they find that they get tired very easily. So weight can be quite limiting in this way. For other people, they face medical problems related to the excess weight. The commonest one that everyone knows about is diabetes. But problems with cholesterol and high blood pressure are also quite common in this group. One very typical thing at night could be snoring and difficult to breathe when you lie flat. That's also a problem related to excess weight. For ladies, they might experience problems with their menses. The menses become irregular and sometimes they keep missing menses. Or, on the other hand, sometimes they have very heavy flow. So excess weight in a lady can lead to irregularity of menses and, in the worst case scenario, make it difficult for them to conceive and have children. So this is a very important problem for women. In addition to that, because female hormones and the amount of body fat that we carry is actually quite closely interlinked, so women have a higher risk of gynecological cancers the more heavy they are or the more excess weight that they carry. So it's a bit of a double whammy for women. Now, another group of people who can benefit from losing weight will be people who feel that they have low self-esteem, they're too shy, they're afraid to go out, and they feel that they are bullied, ridiculed, and made fun of because of their weight. And I think that can be a very debilitating problem for some people and making them very afraid to venture out and do anything that might put them in the spotlight. So I think if you are suffering from any one of these problems or you know someone that is, then there should be really no stigma to prevent you from taking control of your weight, taking control of your life. And there are options to help. Bariatric surgery is not the only option that you need to have. In fact, we should start off by looking at all the different aspects of your life, looking at some of the dietary habits that you have. It's quite possible that you have good habits, it's just that one or two culprit foods sneak in, maybe a large latte every day, or the kaya toast in the morning, or the favorite breakfast dish for people is roti prata, and cutting down some of these things can help. On the other hand, people sometimes feel that they work very hard, but actually they're not really getting any proper exercise for the body. For example, you can spend the whole day in the office. You're sitting there, working on the computer, moving to your printer, talking to your clients, but that is not really a concerted activity performed by the body. What do I mean by that? When you're moving here and there, it's not really an effective way to burn excess body fat. That can only happen if you do something that often people call cardio, right? What does that mean? It means you take a walk and you start moving, or you go for a jog, or you go swimming, or you go cycling, or you get on any one of those machines like an elliptical trainer or a cross-training machine, and you keep working out and you cross 20 minutes, 30 minutes. Now you know that you can start burning fat. So you need to do something active. If you don't have access to a gym, that's okay. You can just go for a walk, just go downstairs. If you have a dog, you can bring the dog for a walk. I always tell my patients who have young children that that's perfect, because you can put your kid in a pram and just go out for a walk. It's so much better than giving them an iPad and they spoiling their eyes doing all that as well. So it helps the child, it helps you when you can get out and appreciate the good outdoors. We are quite blessed in Singapore that we are quite safe and we can walk in most parts of Singapore very safely without having to worry about the dangers that are present in many of our neighboring Asian cities. Actually, it's very important for us to understand why anyone would want to lose weight. Because if there was no real benefit from losing weight, then why bother, right? So here are the potential benefits from losing weight. One is that physically, as you become more active, everything feels lighter and easier to do. So people tend to get outdoors more and just have more fun with life. I mean, if nothing from a medical standpoint, but just enjoying life is something much easier to do when someone loses weight. From a medical standpoint, actually losing weight can help you to reduce your blood sugar levels. That means it can actually control diabetes. Now, I always tell my patients that if you are diabetic and you're taking medication, if you get out there and do a 30-minute walk, that could be as effective as taking one tablet. So if you like to swap out your medication if you feel that you want to avoid taking medication, then taking control of your weight could be a very useful alternative. Even for blood pressure and cholesterol, once you change the habits, eating habits as well as lifestyle habits, blood cholesterol levels can fall and blood pressure also tends to fall. So there are clear medical benefits for weight loss. There are clear physical benefits for weight loss. But what I like to emphasize is there are very powerful psychosocial benefits for weight loss. Because when people lose weight, they become so much more confident. One of the best things that I got from one of my patients was that he was quite heavy. He was about 150, 160 kilos, and he went through a bariatric surgery to lose weight, and he lost about 40 kilos. So it was still a big guy, it's about 120 kilos, right? But his whole outlook on life changed. He became so much more confident, and his job offers just came flooding in. And after that, I remember he called me up about 1 year out after his surgery, and he had a celebration. He wanted to go out for a celebration dinner. Not that he could eat that much, but the reason was that he got job offers from Hong Kong and Shanghai, and in the end he decided to go to Hong Kong. So it was something very exciting for him that it completely changed his life around after he lost the weight. So I think that these are all very powerful reasons, and each one of us, in fact, I like to give people homework to do. I ask everyone to go home and think about what your own personal fears are, what your own personal motivations are. And if you could think about those things for a while, then those are exactly the things that we want to help you to overcome and achieve. For ladies, weight loss can be a very profound change. In the first instance, people with irregular menses or difficulty to conceive will find it much easier to get pregnant. In fact, that's one of the things I warn my patients, that after they lose weight, they have to be careful. If they're not planning on having children, they might just find themselves pregnant, and then they will have to deal with that. So it's a lot easier for a lady to conceive if she's been overweight and then she loses weight. In addition, during pregnancy, if you've already lost some weight, the whole pregnancy will have a much smoother course. The chances of developing high blood pressure in pregnancy, also known as preeclampsia, will be much lower, and also the chances of developing gestational diabetes mellitus, which is high blood sugar during pregnancy, is also going to be lower. So the whole progression of pregnancy also tends to be smoother. And finally, when it comes to delivery, if you don't gain too much weight, then the delivery process will also be a lot smoother, and the recovery after delivery will be smoother. Whether or not you have a normal delivery or you go for cesarean section, both ways the recovery is much faster. So I think for ladies, there's a very, very strong reason to take control of their weight. At what age should you consider trying to lose weight? Now, that's a very interesting question that I get all the time. Actually, weight loss can be beneficial to different people at different ages. Now, the most powerful time to lose weight is actually when you're younger, because your whole life is ahead of you. Just imagine someone who is 120 or 150 kilos at the age of 20. If that person lost weight and became fit and athletic, then they're looking at a very long life ahead of them. Whereas if you're overweight and worse, in the obese range at a young age, then the lifespan is usually shortened by about 20 to 30%. So losing weight, if you're overweight or obese at a young age, can be very beneficial to prolong your life, because at that point you can prevent the development of many complications of excess weight, such as diabetes and hypertension. Usually, if people are a little bit older, then they may already develop some of the complications of excess weight and obesity, such as diabetes and high blood pressure. In that setting, losing weight will be beneficial to help to control these medical conditions, to help to perhaps eliminate the need for medication, and most importantly, to prevent the risk of complications of these conditions setting in. So as young as 18 to 20 years old, if someone is overweight, they should seriously consider taking steps to reduce their weight. But even if people are older, in their 50s or 60s, that is still not a reason that they should not make an attempt to lose weight. As long as someone is physically fit and active, I have operated on someone to lose weight when he was 70 years old. He was a fit and active engineer. He was still working in his company, and he was 150 kilos. He just felt that he was a bit heavy and struggling when he was getting around the job, because he used to go and do site supervision, things like that. And so he went through a bariatric surgery and he lost 30 to 40 kilos, I think. So he got down to about 100 over kilos, and it completely transformed him. And not only did he enjoy his work, he also enjoyed playing with his grandchildren as well after that. So I think age should not be a barrier, but certainly if you are young and you are overweight, before you get any complications like diabetes or hypertension, you should seriously think about losing weight. Bariatric surgery is most powerful when it's used to control not only weight, but also to take care of all the medical problems that are associated with weight. So many of my patients, when they come in, especially if they have diabetes or high blood pressure, one of the first questions I ask them is, do you want to be free of all these conditions? Do you want to be free of medication? And oftentimes they will sit back and look at me and say, huh? Like that one can, man? I thought when I have diabetes, I have to take medicine my whole life. And sometimes that's surprising, because that's what we are taught in medical school. But in reality, if you are overweight or obese and you have diabetes, the very fact that losing weight can help you to control your blood sugar means that you may have this opportunity that you can stop your medication. So in effect, if you're overweight or obese and you have diabetes and hypertension and high cholesterol problems, you are almost the perfect candidate to undergo weight loss treatment, because that can help you to eliminate all the need for medication. If you have diabetes, if you just got diabetes, then the chances of developing the complication of diabetes is not high. But if you have diabetes for more than 3 years, then the risk of complication increases. And for people who have diabetes for 10 years, then they are most likely would have started to develop the long-term complications of diabetes. And these are problems with eyesight, retinopathy, problems with the heart, because you can start having coronary artery disease, problems with the kidneys, because of circulatory problems in the kidneys, as well as problems with the blood circulation of the extremities, so putting you at risk for numbness of the fingers and toes, as well as gangrene of the toes. Okay, so one of the most powerful benefits of weight loss surgery is that when you lose weight, many of these complications can be slowed down and in a small group of patients even reversed to some extent. Okay, so this is one of the most exciting things that I've realized about it. In fact, the very first patient that I did a gastric bypass surgery for came back to me about 9 months later, and he said, you know, he went to see his eye specialist, and the eye specialist asked him, what did you do? And when he asked the eye specialist, why did you say that? He said, well, he checked his retina and he found that all the retinopathy, all the blood vessels have started to clear up and improve. So normally when there's disease in eye disease and diabetes, the blood vessels all become a little bit blotchy. And so interestingly, I went back to look at the data. So 30% of people who reverse their diabetes after undergoing weight loss actually can experience improvement in some of these long-term complications of diabetes. So the eyesight can actually improve. The risk of heart attack will come down, and the risk of kidney failure will also reduce. If you lose weight when you have diabetes, you can potentially reduce your risk of all the long-term complications of diabetes, such as eye damage, also known as retinopathy, heart disease, as well as kidney disease. All of these complications can actually be reduced and sometimes reversed so that your kidney function or your heart function can actually become normal again.